And next we have Dr. Bjorkman from the University of Gothenburg Center for Person-Centered Care in Sweden.
Thank you so much. Can you hear me well?
Yes.
Yeah, the sound is good. Okay. Thank you so much for inviting me. I'm excited to be here. You're just starting your day over there, and I'm at the end of the day. It's the afternoon. It's dark outside my window. Well, I'm going to talk about PPI in Sweden, and I'm an associate professor in nursing at the Institute of Health and Care Sciences, and a researcher at the Center for Person-Centered Care. The situation in Sweden is very much similar to what the previous speaker talked about in Ireland. There's one major funding body called the Swedish Research Council. And they demand open access, for example, and these are the reasons that they give. We believe that everyone should have access to the results of research financed via public funds. Research results that can be read free of charge on the internet also reach stakeholders outside the specific field. And people outside the research community have the opportunity to partake in scientific articles linked to their occupational activities. And lastly, research published with open access spreads faster, and the articles are cited more often. So these are the reasons given. Maria showed this before, and so what that covers in the previous slide is pretty much the open scientific knowledge and the open infrastructures. But this model also shows that we need to have an open dialogue with other knowledge systems and an open engagement of different social actors. So I'm going to share with you a project that we are currently working with. I just want to tell you a bit more about the center, because the center is, it's a national interdisciplinary research center collecting 200 plus researchers. And the aim is sustainable healthcare through sustainable health through sustainable care. And that also means that we need to create sustainable healthcare systems through collaboration. So we're not only doing research, we're also doing education and collaboration with different groups. We had different advisors at the center. We're very lucky that Maria Jose Santana is one of our advisors. We also have a person council, which is a group of people with many years experience, personal experience, as patients, relatives, or carers. And they have a strategic function, an advisory function. So the government funds the center, and then the center in turn funds different projects. So we want to implement PPI during all the phases of the research process. In this picture here, you can see the person council. All through identifying research questions, literature reviews, developing the methodology, data collection, analysis, conclusions, and then communicating the results. But the Person Council actually raised a question that they're not so much involved in the first phase, actually, in identifying the research questions or problems. So that kind of ignited this project that I'm about to share with you. So it was initiated by the Person Council and Pamela Lindgren, who is a patient co-researcher and part of the Person Council. And Jana Bergholtz, also a patient co-researcher, was involved in this project. So we aimed at creating a shared vision for person-centered care in Sweden. And we wanted to involve the citizens and different various stakeholders to prioritize among research questions. And we chose to do that through a framework called strategic foresight. So this is a framework that is used for strategic development by the UN and the European Union and so on. And it's a way to get better prepared for different futures, but also to create shared visions. Where do we want to go? What's the future that we want? So there's certain driving forces, and these could be local or national or even global trends. Sometimes we talk about the mega trends. Those are trends that are actually larger than countries. And that could be, for example, demographic changes or artificial intelligence and so on. So we have these mega trends that kind of drives towards the future. And then we want to put that in dialogue with the diversity of perspectives from different stakeholders in an interactive and creative phase. And then kind of path the way to different plausible futures. So a range of methodologies can be employed when you engage in strategic foresight. And what we did was that we conducted workshops, we created visions, we did some horizon scanning, and then we aimed at a prioritization exercise. We didn't quite get there. I'm going to tell you about that in a minute, but that was the aim from the start. And we wanted to involve different groups: patients, relatives, healthcare professionals, decision makers, management, and also researchers. So we wanted to identify urgent problem areas and challenging situations. And in this first phase, the focus was Sweden. And we wanted to engage in those problems that could be connected to person-centered care. We wanted to identify important areas for new research and research questions. And then we wanted to prioritize among those research questions. So in a first pilot project, we conducted workshops with family and patient representatives, healthcare professionals, leaders, managers, decision makers. So in this first phase, we did not involve the researchers, but all the other groups. And then the Person Council was asked to prioritize among the themes that were identified in the first phase with the workshops, and also contribute their own visions. So we use something called appreciative inquiry, which is a qualitative method where people are asked to kind of share their vision for a desired future. So we asked them to write a short story about your vision for the future regarding people's health, healthcare, and care in Sweden. So that was an individual exercise. And then we wanted them to team up in groups and process the visions. We wanted them to discuss what prerequisites for the realization of the vision already exists, what's already working today, and what needs to change for the vision to become a reality. So we collected all this data from the individual visions and then the group discussions. And we ended up with 4 wide areas that they felt was of most importance. it was a health promoting society, a society where the children learn in school about diet, about exercise, about mental health. It was a health promoting society where cities were green and you could walk and you could ride your bike instead of going on in your car. It was a healthcare that was digitalized, but it was also accessible, so you could meet your healthcare professional in person if that was what you wanted. So the digitalization was not supposed to replace the human-to-human interaction. The good meeting was a prominent theme, to be respected, to be listened to have one's expertise respected. And then there was this theme with the learning trusting organizations that the healthcare professionals had the time to do what they do best and not get stuck in endless administrations and so on. So these were the four large themes from the visions. So we brought them back to the Person Council to let them know or to get their view on these different themes. And they thought that it lacked an explicit focus on self-care and self-care support. So they wanted to add that. They also want to add issues of resource allocation. What is it that healthcare needs to prioritize? Because we have a movement right now in Sweden where we want to shift resources from the hospitals to primary care, for example. They did not want to prioritize because they felt that all these areas are important. So they wanted to see if there were prerequisites to start projects in all the different areas, actually. They also wanted to map the projects that already exist, that are already financed by GPCC. They also felt that it was important that projects that were started are cost effective. So they highlighted the risk of research waste if interventions created and so on were not cost effective. So conclusions and going forward, well, this is a work in progress. So we have a lot of work to do still to boil these themes down to actual research questions and put together groups of patient carers, clinicians, and researchers that have an interest in the different areas. But we can draw the conclusion that a shared vision is of utmost importance for a person-centered healthcare service. We need that goal. We need that vision. Where do we want to go? And it needs to be a shared something, a vision that's meaningful for everyone. To do these exercises also empower actually all the different groups. That was the feedback we got, that it was a meaningful endeavor to them. And well, to be continued, we're working on it, and we'll see if we're working on project plans and see if we could get some projects going from this endeavor. So thank you so much. I'm happy to discuss if there's any questions or comments or anything like that.
Yeah, so we have the time, I think, to take one question for Dr. Bjorkman. Does anyone in the room have questions? This one's.
Hello. Hi, thank you very much for your presentation. I had a question about the Person Council. So how does it work? So it's all the research in Sweden goes through them, or is only some researchers want to engage public go to them? And the composition, is it like the same people all the time, or is it changes with like what's their term if they're same people all the time? Yeah, thank you.
Yeah. Thank you. A great question. The Person Council is linked to the center. So all the research is funded by the Gothenburg Center for Person-Centered Care. They review the projects there, so it's not for all of the university or like that. It's for the center. And the Person Council, they have time-limited obligations. So I can't say if it's a year or two, but it changes the participants on a regular basis, and they're employed. They get paid by the center for their services, an hourly payment. Yeah. Did that answer your question?
She just also wanted to ask how many people were involved on the council.
It's between 10 and 15. I think right now it's 12.
Great, thank you.
Thank you.
Oh, we do have one more question, so we'll take that before we head to break as well.
Sorry, just in trying to convince people why this model is superior, is there any mechanism you have for explaining the harm or the waste or inefficiencies that are caused by the I guess legacy system that we have that doesn't start with the stakeholders and identifying what the problems the stakeholders consider that they have and the priorities that these stakeholders have?
I mean, I don't know really. I think the arguments are quite convincing. For example, in the area of pharmaceuticals and medtech, that a lot of different technologies, for example, reach the market that is of little or no value to the patient. So, I mean, it's to me, it's quite, the evidence is quite convincing that we need to start with the actual needs and prioritizations of the citizens. But I don't really have it's not in the model or anything. No. I'm sorry, did that answer your question?
Yes, it did.
Okay.
Thank you again, Dr. Bjorkman, for your presentation.
Thank you so much for having me.